Today we are discussing infant mortality rates among African Americans. I'd like to begin by highlighting the importance of this discussion as infant mortality is a crucial indicator of a population's overall health and well-being. The infant mortality rate is considered a highly sensitive measure of population health because it is linked to various factors that affect the health of entire communities. We will be discussing what factors these are. These are the social determinants mapped out that lead to infant mortality. The risk factors begin with individual factors, race, ethnicity, community factors, prenatal factors, preterm birth, and low birth weight. Infant mortality is the result of these factors all in combination working together. How does infant mortality affect African American populations? Well, non-Hispanic Blacks and African Americans have 2.4 times the infant mortality rate as non-Hispanic whites. They are also 4 times as likely to die from complications related to low birth weight as compared to non-Hispanic white infants. There are also 2.9 times the rates of infant death syndrome. And in 2020, African American mothers were twice as likely to receive late or no prenatal care as compared to non-Hispanic white mothers. One of the things that I found interesting was that research on racial disparities in maternal and infant health often overlook pre-pregnancy health. The factors contributing to increased stress among African American that would be implicating their mental health would include housing instability, substandard living conditions, systemic bias in education and employment, single motherhood. There is the early programming model, which consists of factoring in early life risks that can lead to complications like maternal depression. The cumulative pathway model is emphasizing that chronic stress leads to allostatic load, increasing maternal and infant mortality risks. African American women are also considered to have higher stress levels throughout their lives, worsening health outcomes. Black immigrant women and younger African American women would typically demonstrate better birth outcomes, indicating exposure to cumulative stress. We will be discussing a little bit later on the type of factors that consist and compose issues that raise stress levels throughout their lives. The leading cause of death ranked with the African American non-Hispanic population. As you can see, the low birth weight has 1.1. Congenital malformations is 7.5. Sudden infant death syndrome. Oh, I'm sorry. These are the numbers of deaths. Pardon me. Low birth weight is. We will now be discussing the rates per 100,000 live births, which took place in 2020, and the leading causes of infant mortality. The causes of death ranked from the population of African Americans begins at 1,136 for low birth weight, 705 infants died from congenital malformations. 472 infants died of sudden infant death syndrome. There were 375 accidents that led to casualties, and maternal complications arose to 337 in 2020. Again, this is 100,000 per live births. As you can see, the age of mother is also a risk factor, as evident by this graph. The higher peaks are at under 20 years at 12.4, and 40 to 54 years old, we have 11.6, and this is per the rate of 1,000 live births in 2020. Several physical health behaviors and conditions affect maternal and birth outcomes, but many behavioral interventions primarily target two main issues, which we will discuss. And these would be the factors that would increase the likelihood of these maternal and infant deaths: smoking and drug use, obesity, sudden infant death syndrome, unintentional injuries, maternal pregnancy complications, inadequate access to health care, exposure to racism and discrimination, lower maternal educational attainment. Much of what we will be talking about has a lot of impact on your mental health. These differences in maternal mental health alone don't fully account for disparities in birth outcomes between African American women and non-Hispanic white women. Though African American women do often report African American women often report lower stress levels during pregnancy, but may lack awareness of mental health symptoms. So I would like to take a second to speak about this, as it does claim that they report lower stress levels, but they are unable to recognize what these symptoms are, and maybe they don't understand the manifestations of stress leading to poor mental health, or even physical health leading to poor mental health, as also incorporating several of the other factors we have discussed. Because of differences in the infrastructure that has made up the framework for this sample size, a significant knowledge gap exists regarding signs and symptoms of mental health challenges among women of color. These mental health issues are frequently underreported, and symptoms remain unaddressed. Inadequate mental health care fails to address the unique challenges faced by women of color, including race, gender discrimination. Increased stress has linked to higher rates of depression among African American. Increased stress also can induce other disorders like anxiety, depression, post-traumatic stress disorder. We will now discuss the poverty and low income status. The research indicates, according to the California Department of Public Health, that African American women face significantly higher risks of maternal infant mortality compared to white women, even the account for education and socioeconomic factors. The California Department of Public Health published a study that found the risk of dying from pregnancy related complications is nearly 3 times greater for African American women. Also, college-educated African American women are almost 3 times more likely to experience infant loss than white women that have the same level of education. Race and geographic ancestry. Differences and birth outcomes stem from genetic variations between African American and white women. Despite attempts to adjust these socioeconomic factors, significant disparities in infant mortality rates have persisted. However, this reasoning is now considered unlikely, as over 90% of human genetic variation exists within the populations of a continent, with only 5 to 10% attributed to gene frequencies among different continental groups. Instead of being seen through purely genetic lens, race should be understood as a social construct. Social construct. Because this exposure to racism impacts interpersonal racial discrimination, which is linked to poorer pregnancy outcomes. Chronic stress from discrimination can lead to physiological changes, including increased inflammation and compromised fetal development. A study indicated that African American women who delivered preterm low birth weight infants reported higher levels of interpersonal racial discrimination. The impact of perceived discrimination was pronounced among women 20 to 29, which are the childbearing age that have the highest rates of childbearing age. Coping behaviors may influence the relationship between discrimination and preterm birth, such as drugs and alcohol and dependence, substance abuse. In a past study, it was found that perceived interpersonal racism did not correlate with preterm birth in women in mild moderate depressive symptoms, but did so in those with severe depressive symptoms. The findings also suggest that the effects of racism or preterm birth risk may differ from an individual's baseline risk levels. Prenatal care needs to be considered as one of the most important factors in delivering a healthy term baby, as this minimizes the risks of maternal and infant mortality by screening the mothers, providing educational support for parents, guidance on healthy practices. Research also indicates that a smaller proportion of African American women obtain prenatal care to non-Hispanic white women. However, the disparities in access to prenatal care do not fully account for the racial differences observed in maternal and infant mortality rates. In fact, African American women who begin prenatal care in the first trimester will experience higher infant mortality rates compared to non-white women who receive late or no care at all. I'm a domestic violence counselor, and I understand greatly the intersectionality between domestic violence and term pregnancies, especially how it affects women of African American descent. As you can see, 45.1% of Black women experience domestic violence. An estimated 51.3% of Black female homicides are related to intimate partner violence. Recognizing this as a significant public health issue, we can identify effective interventions. The relationship between intimate partner violence, racism, maternal mortality among birthing individuals is critically underexplored. Approximately 45% of Black women experience IPV, intimate partner violence, significantly higher than the national average of 27% for all women. Additionally, Black women have the highest maternal mortality rate in the U.S. at 69.9 deaths per live birth in 2021. Why is this important? Because pregnancy is a dangerous time for women in abusive relationships. Domestic violence during pregnancy puts the unborn child in danger. It increases the risk of miscarriage, infection, premature birth, injury, or death to the baby. It can also cause emotional and mental problems such as stress and anxiety, which can affect the development of the baby. 1 in 6 women have been abused by a partner. Around 30% of domestic abuse begins during pregnancy, while 40 to 60% of women experiencing domestic abuse are abused during pregnancy. Solutions. We have identified a few solutions according to Alhunsen in 2015. If you require the state to extend Medi-Cal postpartum coverage from 60 days to 12 months, providing essential support for new parents after the baby's delivery, the Black Maternal Healthcare Mobius Act takes action through historic investments that address every driver of maternal mortality, morbidity, and disparities in the United States. It is the only legislation in Congress that will comprehensively address America's maternal health crisis and save moms' lives. Passed the Preventing Maternal Deaths Reauthorization Act. So, the Preventing Maternal Deaths Reauthorization Act will provide continued federal support to state based maternal mortality review committees. This will help maintain maternal health throughout pregnancy, childbirth, and the postpartum period, addressing disparities in maternal health outcomes and developing solutions to improve healthcare quality and outcomes. While preventing future maternal deaths, public health interventions address environmental, economic, and social and cultural stressors. We can also think about expanding telehealth services to fill in the gaps of healthcare, particularly in gynecology and obstetrics, in maternity care deserts. Community-based initiatives like the REACH program work to challenge the healthcare provider prejudice. As African American infants experience significant higher mortality rates than white infants with disparities not solely explained by individual risk factors. The life course approach to reduce infant mortality disparities addresses early life disadvantages and ongoing social determinants like neighborhood poverty, crime, segregation, and racial discrimination. To improve one's mental health, suggesting the following initiatives that are based on health and medical well being as they impact mental health severely. We can begin with nutrition by providing access to fresh food, perhaps meal delivery programs. Create awareness around these programs. All these programs and all these initiatives or organizations need to be, their presence needs to be amplified. People need to know they exist. Transportation services to food should be provided. Food trucks going to low socioeconomic areas. Breastfeeding support. Physical fitness can be applied by exercise education, free gym passes, recreational equipment in recreational park and parking areas. The development of support programs such as home visiting, mobile doctors, crisis couple and family counseling, group support, support lines, also employment and educational opportunities like creating temporary job placement, study trade programs, library access, book subscriptions, also continuing supplemental and also providing more resources to continuing and supplemental education. In high school, sex education, family life, and home economics can be part of the curriculum in order to enrich and educate children. Childcare resources like free daycare, home babysitters, personal birthing coaches, Also, being able to provide essentials to birthing mothers like clothes, crib, changing pads, bottles, anything that could help ensure the safety of the baby. Safety, like securing car seats. Sometimes car seats can become a hazard in automobiles by having them improperly secured or having the baby improperly fastened into the safety seat. Health awareness, vaccinating newborns at the right age, birthing classes, drug and alcohol recovery, and drug and alcohol education programs.